Diabetes and weight loss drugs continue to skyrocket in popularity. 2025 is expected to be a big year for the industry. You just saw semaglutide and Ozempic as more and more people try these drugs. But we are seeing more reports of so-called Ozempic face. That sounds scary. The face starts to lose some fat, making you look a little bit hollow. So joining us now to talk about this and some solutions, Karan Lal, Dr. Karan Lal, affiliated dermatology. Good seeing you.
Nice to
Sir
meet you.
Derms a lot if you know him on social media. All right, Ozempic face sounds scary. What's going on with Ozempic face?
So Ozempic is a wonderful drug. It's in the category of medications called GLP-1 agonists, which basically help with weight loss, diabetes, reducing cravings and things like that. The problem is, initially these drugs were used for people that had obesity, they were overweight, they had a lot of these comorbidities. Unfortunately, when things work well for those people, they've kind of trickled into the regular adult population, you know, people that are normal weight. And a lot of people have been using these medications inappropriately because you can get them at a medical spa, you can get them at all these offices for weight loss. The reality is someone like you and me don't need these medications.
Oh, that's very nice of you to say that.
And what's the truth? So I've had a lot of patients actually over the past 2 years, including my mom, so you guys will see, who is on Ozempic for diabetes. When you lose fat, fat is actually one of the anchors in your face, and it's holding your skin up. So as you can tell,
Dr. Law, let's look at this. Is your mom. So keep going.
Yeah.
So tell us what happened with her here.
Yeah. Yep. So on the, you can see, you know, on the top, those pictures are right recently after being on Ozempic for 2 years for diabetes. So she came in, she was visiting me, and she says, I'm looking so old. And you can see on that lower face in the upper photos, there's a lot of sagging there of the skin. And so I essentially used some hyaluronic acid-based fillers to help, you know, structure and snatch that skin and kind of lift that skin back up. So replacing the volume that was lost inappropriately because she's on Ozempic.
So, and you're saying people like you and I, let's say we were 10 or 20 pounds heavier than we are now. Is that what you're seeing people use these?
Yeah, like people are using it as an easy way to lose weight instead of exercising and dieting. And the problem is, not only do we have these skin changes, your skin becomes saggier because we're losing that fat in the skin, but there are also health concerns. You know, particularly there's a black box warning for people that are getting a lot of reflux because, you know, the medication stops your gut from working, and people are getting constipation, bowel obstruction, and so you have to wait.
What does it do?
It's essentially causing your gut to slow metabolism. So these essentially were, you know, extracted from lizards and, you know, geckos that have a very slow metabolism. So when you give them to people, it makes your body think that you're full. So you're not eating as much, and so things stay in your gut for a longer period of time. So things take longer to make it through the gut. In return, you lose a lot of weight, you reduce cravings, which is great for people that have issues that are related to those things. But if you're using them inappropriately and you're someone that's of an average weight, you know, your face is going to start looking older. So people are coming in looking 10 years older than they should be looking, and we have to fill their face up with filler and biostimulators to help them look their normal age again.
Okay, so we've got about 45 seconds left. If somebody does have Ozempic face, what would you do for them?
I think the first thing is to figure out, looking at your diet, making sure you're eating an adequate amount of protein, making sure you're exercising, and then see if you're a candidate for volume replacement.
All right, thank you very much.
Thanks for having me.
Sir Derms a lot on all your social media posts?
Yep, Sir Derms a lot with a Z on Instagram.
He's a star on there. Check him out.